Good morning, everyone. This is Rick Pruscia, and I'm joined by Christy Johnson. We're with Premier Marketing, and just a real quick, want to give a quick rundown of the reason for us having this webinar today. Premier, we've got two offices, one in Dallas, Texas, also the home office here in Norfolk, Nebraska, and this year we celebrated 50 years in the senior insurance market. Originally, Premier started off as long-term care. A lot of places did, a lot of agents did, but that's changed over time. 10 years ago, the individual that built Premier's long-term care department to what it is today came to a crossroads. After 30 years in the business, she got tired of not having anywhere to go with long-term care declines, or people that can't afford the rising costs of traditional long-term care. So that was the catalyst that led to Premier becoming what I would happily argue, maybe I'm wrong, but I'd happily argue is one of the top short-term care marketing organizations in the nation. With that being said, Premier has probably more alternative products to traditional long-term care than any other marketing organization out there. It's beginning to change because a lot of other FMOs are realizing how the market has changed, how lucrative short-term care is, but of all those short-term care options that Premier works with, I would say the Aetna Continental Life, they have one of the most successful comprehensive short-term care products, and that would be their recovery care plan. And when a client can't qualify for the recovery care, they also have another option waiting for you, their Home Care Plus. So today, I wanted to get you more familiar with Aetna, and I wanted to get you more familiar with not only the products, but I wanted you to realize that you can finally fill out that client's portfolio that you weren't able to get them underwritten for long-term care, or you weren't able to get them affordable long-term care. So that's one thing we wanted you guys to focus on today. But also, we wanted to add to your bottom line some way to turn on the lights every month. And then we also wanted you to be able to join us. Every year, Premier takes our top producing agents somewhere warm. So I wanted to help your clients out, I want to help you out, and I want you to be able to join us for our 2020 producer convention. And without further ado, I want to hand you over to Kevin with Aetna, and he's going to let you know about some of their terrific products. Kevin, thank you very much for joining us today.
Thank you, Rick. Thank you, Christy. Thank you to everyone at Premier. Good morning, ladies and gentlemen. Thank you for taking some time out of your busy day to spend with us. We're going to hopefully make this pretty short and sweet for you. We don't want to take up too much of your time, but we are going to bring you some very valuable information. First, as Rick mentioned, let me introduce myself so that you know how to get a hold of me in case you ever have questions beyond what we talk about today. So my name is Kevin Moore. I'm a regional sales manager for the Western region with Aetna Senior Supplemental Insurance. I know it says my home address there, or my location is Franklin, Tennessee. That's actually not totally accurate. That's where our home office is located. I actually live and spend most of my time in Texas because it's one of the states that I cover, and that's home for me. So beyond that, I also cover all the states that you see listed down in the bottom left-hand corner. So if you happen to be marketing in any of those particular places, I'm your go-to guy if you need help or assistance with any of the Aetna senior products. And if you happen to be in another state, that's fine too. You can call me as well. I do have counterparts in the other states or other regions, but I'm happy to help in regardless of where you're located. But let me point out, my email address is here. You're welcome to, reach out to me if you have questions or concerns about anything we cover today or any other Aetna related products. So my email is morek7@aetna.com. Again, morek7@aetna.com. And you're also welcome to call me. This is my office and my cell phone, so you can actually call or text me here if you have quick questions you want to ask. I get texts and calls all day long from agents, and I love helping out, so feel free to reach out. So 615-927-1089. Also want to point out our website is aetnaseniorproducts.com. So anything and everything related to what we're going to discuss today as far as Aetna Senior Supplemental Products, you can find additional information on that particular website. Again, aetnaseniorproducts.com. Little bit of background just real quickly on Aetna Senior Supplemental Insurance. So as I mentioned, we're based in the Nashville, Tennessee area, actually a suburb of Nashville called Franklin. We have an extremely dedicated agent services team. We know that if and when you happen to have an issue with a policy or with a commission or anything related to something doing business with us, that you need good help and support. So we've got a great team. If you ever need to call us and get help, I can tell you without a doubt that you're going to have some great people there to assist you. Also, we're very focused on business persistency. We know it's important for you to write business that stays on the books. It's important to us as well. So we put a lot of measures in place to help maximize your persistency. We do our absolute best to give you a product that not only brings great benefits to your clients, but also at a very competitive rate or a competitive premium. So you can count on us to have as good, if not better, competitive premiums versus the other carriers out there with similar products. In addition to that, we know you want to get paid for what you do. So we've got top commissions and growing renewals. I believe most, if not all, of our products now have a lifetime renewal. So once you write them, as long as that policy exists, you're going to have an ongoing renewal stream coming in from it. So many of you may be aware that our core product, or our flagship product, if you will, is our Medicare supplement. Well, in addition to that, we have a complete portfolio of other products designed to be cross-sold in the senior market. So that's part of what we're going to talk about today, is a few of our short-term care products that can really target a specific need in the senior market. And by the way, we've been in the market for over 30 years. Many of you are familiar with us probably under the name Continental Life. That was the old company that was acquired 7, 8, 9 years ago by Aetna. So it's now operated as Aetna Senior Supplemental Insurance. But that's where we get our 30 plus years, is the time and experience with Continental Life. We're a fairly small company in terms of personnel. We only have about 400 employees, which isn't huge. So, it's kind of like doing business with one of the large carriers, but we've got a lean, mean, and great staff in place to help assist and support all of our policyholders and our agents. We are an A-rated company by AM Best, which classifies us as excellent. Good to know that you're representing one of the best when you're out there pushing the products. We've got 4 separate charters or entities that we operate under. They're all listed here. You've got Aetna Health and Life Insurance Company, Aetna Health Insurance, American Continental, and Continental Life. Those aren't really particularly what I would consider as different brands. They're just different charters that we use to file products under. If you look at any of our product materials or brochures, you will see they are branded at the forefront as Aetna products, but they'll also have one of these entities listed because that's what we use to file it with the state that it's in. This is a quote from our president and CEO, Ty Woldridge. I always think Ty has great things to say. I think he's very smart about the market that we're all working in. So I try to pay close attention anytime that he's got a message to deliver. And this is something from an article he wrote in our newsletter that we put out each month several months ago. But for whatever reason, this particular line always stood out to me. And he just says, "We want to be the last insurer your clients ever need or want, and for as long as they live." So hopefully that gives you a little bit of a peek into our leadership and what our goals and directions are. Here's a list of all the products we offer. As I mentioned, we have our MedSup as our primary, our core product. We also have a final expense. We have a critical illness called cancer and heart attack or stroke, hospital indemnity products, and then we get into the short-term care products, our nursing facility and recovery care, our home care and home care plus, which are the 2 products we're going to focus on today. Again, recovery care and home care plus, those are the latest and greatest products that we have in terms of short-term care. And then we also have a really nice dental vision hearing product that's out and available as well. If you're ever not sure if whatever market or state that you happen to be working in has a particular product available, I know this is a little hard to see, but I just wanted to kind of show you what it looks like. This is something you can always find on our website, again, AetnaSeniorProducts.com. This is a grid or a list that will show you what state has which product. So you could easily be able to, not particularly on this one because it's a little small, but you can easily check to see what state that you're marketing in, if it has the product you want. I can tell you that for the most part, the 2 products we're going to discuss today is going to be in most of the major states and markets that we operate in. So before we get into product, I always like to ask everyone that I talk with 2 questions. And I never know who my audience is in certain cases. It could be a ton of, former long-term care or still operating long-term care agents, or it could be Medicare. Oftentimes it is people that work specifically in the Medicare market. So I try to encourage, especially those that work specifically in the Medicare market, to start opening up and thinking about ways to help your clients beyond just their major Medicare, whether it be a Medicare Advantage or a Medicare supplement. So that's the purpose that I asked these two questions. The first question is, are you in this business because you love to help people? I've been asking that question for over a year to every group that I speak with, and everyone said yes. So even though you can't speak back directly to me because your line is muted, I'm assuming you're nodding your head or saying yes out loud, because that seems to be the case with everyone I run across. And that's the same for me. I'm in this business because I love to help people. So I'm glad we're all on the same page as far as that goes. My second question for you is, are you also in this business because you want to make a living? I've never heard anybody who didn't also say yes to this question. So I'm assuming everyone on this webinar is also agreeing and saying yes. And that's me too. You know, I'm in this business because I love it to help people. I'm very passionate about helping clients. I'm very passionate about helping agents and brokers and agencies. And that's what gets me going in the morning. That's what drives me, is I really do like to help people. But I also know that in reality, I'm doing this because it's something that also helps provide for myself and my family. So in order to kind of put all that together, what we can do, especially if we're someone who's not thinking and trying to extend your client's coverage beyond their major Medicare product, is the potential to help them more with additional products. Because let's be honest, when it comes to Medicare, there is gaps in Medicare, and there's going to be other needs beyond just what your Medicare Advantage or your Medicare supplement is going to cover. So helping enhance their coverage, helping your clients have better options and benefits when they need them, is part of what we can do by cross-selling. And then of course, it's also going to help your bottom line and help, as Rick said, keep the lights on in many cases. So cross-selling is a great opportunity to help your clients more and also help yourself more. Not only that, but it helps increase your persistency. Your chances of keeping a client are much, much higher if you can place multiple products in one home. If you look at this chart, this shows that if you could place one product in a home, you got about a 60% chance of keeping that client. If you can increase it to 2 products, it's going to be somewhere close to 70, 75%. If you can put 3 products, you're talking in the 80 to 85% range. Whenever you can put multiple products, stack them, then you make that book of business you have all that much more sticky, and it's hard to break apart at that point. When you can put multiple products in the home, it makes it less likely for another agent, another broker to come in and scoop up your client. So also keep that in mind. We can help people more by selling additional products, help ourselves more, and also make our jobs easier because we don't have to chase our clients around, keeping them on the books, because we've taken care of all their needs by getting them the multiple products they need to sustain and keep their benefits where they should be. So with that being said, let's jump into product a little bit. First and foremost, we'll talk about our recovery care plan. This is a fantastic product. I'm really proud that we have it and we can offer it. Here's the latest up to date that we have as far as where the product is available and marketed. So you can see it cover up most of the country. There is still a few locations out there that we haven't quite launched yet. If it's not in your state now, it should be soon. We're working on getting it rolled out in as many places as possible. With this policy, it's an opportunity for your client to have freedom to choose how they want to recover in a time of sickness or after an injury or any type of extended illness. So it will help cover for all levels of nursing facility care. It's designed to help protect their assets from the high cost of rehab and therapy. It gives the policyholder independence to help and helps them maintain peace of mind when they are dealing with an illness or an injury. And it pays cash to the client. So this isn't something where you would need to be concerned with having it paid directly to a provider. It's going to come directly to the policyholder for them to use that money exactly for how they choose. This is actually a page straight out of our brochure for this product. I would encourage you to go on our website, take a look at it. You can download it from there, and you can also order kits for yourself. 2 things that I want to point out, really, this is really a good thing to share with a potential client, is in the bottom left-hand corner, it says at least 70% of people over 65 will need long-term care services and support at some point. So the overwhelming majority are likely to need this type of care at some point in their lives. Also, the U.S. government, we're looking on the right-hand top side of the page now, the U.S. government estimates the average cost of nursing facility care is approximately $72,000 per year. It's very expensive, and there's only minimal coverage through your Medicare or your Medicare product to help pay for any of that. I won't spend a lot of time on this. I'll just throw it up there real quick. You know, a lot of times we make assumptions based on what Medicare is going to cover for us if we do find ourselves in a point in time where we need to go into a nursing facility. So there's scenarios on the left-hand side. It says if you're confirmed to a nursing facility and cannot perform 2 or more of the activities of daily living, or you have cognitive impairment, Medicare will cover the first 20 days of skilled care only if you are admitted as an inpatient for at least 3 days. It will not pay for intermediate or custodial nursing care. Recovery care, the product we're talking about, it's a daily nursing facility coverage that will pay benefits for all levels of nursing facility care, skilled, intermediate, and custodial. So the point behind that is, if you're admitted to the hospital prior to your stay in a nursing facility and you're only admitted as an observation type check-in or observation status patient, then Medicare is not going to pay your first 20 days. This will pay no matter what, whether you are observation or inpatient in the hospital before that. Not only that, Medicare is only going to cover basically the bare minimum in terms of a facility. So when you think about going into a nursing home, I know probably some of us have experienced that from time to time in our lives. Sometimes they aren't very nice places. Well, think of the worst possible scenario when you think about what Medicare would cover. Whereas with recovery care, it's going to pay regardless of what type of facility or how nice the facility is that you go to. So that's one scenario, and the other two are there. If you're confined to an assisted living facility and you cannot perform 2 or more of the activities of daily living, or you have cognitive impairment, Medicare does not pay for any cost or services in certain scenarios. Our plan would. And then also the third scenario down there at the bottom, if you need home care services and can't perform 2 or more of the ADLs, Medicare will pay for eligible home care services like intermittent skilled nursing with doctor's order. It will not pay for 24 hours a day care at your home. This plan has a rider that you can add in that will pay for the cost of that in-home care. So with that being said, let's look at the product a little bit. You can write this on anyone between the ages of 50 and 89. It will include coverage in an assisted living and or bed reservation facility. It pays that daily benefit for confinement in a nursing or assisted living. Really what it's saying is any and all levels of nursing or assisted living will be covered with this plan. You do have certain triggers that will say when the benefits can pay out. We've already kind of indicated them, but just to make it clear, it's going to be kicking in or triggered once a provider cannot perform once a policyholder cannot perform 2 or more of the activities of daily living, or if they have cognitive impairment. So your activities of daily living are going to be things that we all as humans depend on to do for ourselves: dressing ourselves, feeding ourselves, going to the restroom by ourselves, bathing ourselves, on and on. There's a few more, but you get the idea. So, or if you have cognitive impairment. So if you run into that situation where you can't perform 2 or more of the activities of daily living, that's when the benefits kick in for this. Or cognitive impairment, which is mental impairment, that would also trigger the benefits for this. You can have up to $300 daily paid out. That's the maximum. You could go less if you wanted to. 300 is the maximum. You can choose the number of days you would like to have covered. You can do a small minimum, which would be 90 or 180 days, 270 or 360. 360 being almost a full year at that point. Okay, so depending on the number of days that you have or you've chosen, you have those total number of days available to you multiple times. So for example, if you were to choose a 90-day plan and let's say you used all of your 90 days, that doesn't mean the policy is null and void at that point. You get an additional set of 90 days once you haven't needed care for a minimum of 6 months or 180 days. So 180 days without needing care, without using the policy, not needing the policy, your days will reset at that point. So you get an additional set of 90 days or 180 or 270 or 360. You can build in a waiting period if you like for this. You can do 0-day waiting period, 20 days, or 100 days. My personal recommendation to everyone is do a no waiting period, because the way I look at this is if you end up in a situation where you're ill like this or injured like this and you need this type of care, that's going to be a huge life disruption. And whether Medicare is going to pay for the first 20 days or not, when you're in a life disruption like that, that's usually when you need money the most. So I recommend 0-day waiting period so they can start getting their benefits immediately. And who knows, maybe their recovery is very short. Maybe you only spend a couple of weeks in a nursing facility. Well, then at that point, your 20 days never gets reached. So I recommend a 0-day waiting period. And on top of that, the difference in premium with a 0-day waiting period versus a 20 or 100 is not that big of a difference. You're talking only a few dollars a month extra in premium to have a 0-day waiting period. So that's my recommendation. Start getting your client paid right away. So this policy is built on the back of a hospital indemnity, or on the chassis of a hospital indemnity, if you will. So if you want to, you can build additional hospital indemnity benefits into this product. That's not why most people are buying it. Typically what people are looking at for this is more of that nursing facility benefit, or the other benefit, which I'll show you in just a minute. But you can build more, up to $300 a day into hospital indemnity if you would like on this. It will count for 20 days at a time in the hospital, and you can use a total of 365 days for the life of the policy towards hospital indemnity benefits. And it pays for observation or inpatient stays in the hospital. Again, this is a part of the base of the product, so it's not something you could automatically exclude if you didn't want this, but you only would have to do the minimum, which is $10 a day. So that would be automatically built into the policy at a minimum of $10 a day. You can increase it higher if you want. Again, though, that's not really why anyone's buying this product. They're looking more for the nursing benefits. So now the optional rider that can be added onto this, which I think is a really cool thing, you can actually take this plan and you can build it into a 2-year, or even with your restoration of benefits, up to a 4-year plan, because you could give them a year's worth of nursing facility care at 360 days, which is almost a year. And then you could add this rider on, which you could do a maximum of 52 weeks if you wanted, for home care. So this is going to be a rider that can be tacked on that gives them additional time, and it gives them the opportunity to have their choice or their freedom to decide whether they want to heal in a nursing facility or if they want to heal at home. And me personally, what I love about this is, if and when that time comes, you have the peace of mind knowing that you have both opportunities or both options available to you. I know for me, if I had the option, I'm going to choose, unless I just, for whatever reason, it doesn't work, I'm going to choose to heal at home. That would be my preference. And probably that's the case for most. So you can really do both with this. You can have your nursing facility benefit, and you can have your home care benefit. So this will pay for a week, pays for each week that a beneficiary receives 3 or more professional home care visits of at least 1 hour each. So they have to be receiving at least that level of care. They also have have to have the situation where they cannot perform 2 or more of the activities of daily living, or if they have cognitive impairment. You can pay up to $1,200 weekly as a max, and you have the choice to cover 13, 26, or 52 weeks. And again, once you happen to use all your weeks, you do get those weeks restored once you haven't used the service for a period of 180 days. So great optional benefit to add on. If you gave them a year's worth of nursing facility and a year's worth of home care, you basically just given them a 2-year short-term care plan, which is a pretty nice extended period of time for a short-term care plan. So a couple of frequently asked questions here. What's the period of care? We discussed that. It's 180 days. Or if you're using the hospital indemnity portion, it's 60 days. That would mean that if you went into the hospital today and you started receiving your hospital indemnity benefits, then you can't use them again once you get out of the hospital until you've been well and not, using the service or benefits for 60 continuous days. That's for the hospital indemnity portion. For the nursing facility care or for the home care portion, then you have to not need or use the benefits for at least 180 continuous days. The policy is guaranteed renewable as long as they pay the premiums, of course. Benefits are paid directly to the policyholder. Again, this is cash money paid to the policyholder. Premiums do not increase, which to me is a huge benefit. We can't increase the premiums based on age or health. The only way that we could ever increase the premiums is if we were to do it for the entire block of business, all the clients that we had on recovery care. We've never done that. We never intend to do that. We've built this product from a sustainability point so that we never have to increase premiums. So it's never happened. It's highly unlikely to ever happen. It is a simplified issue product, which I didn't really go into that earlier, but I do always like to mention, one of the troubles today with long-term care is that it's very hard to go through underwriting. And not only that, it's very expensive. This is a product that's got simplified underwriting that acts very similar to a long-term care plan. And it also is much more affordable than a long-term care plan. We do not, it's just a yes or no application. There's no phone interview required. As a broker or an agent, as you're showing this to a client, if you're going to write up an app, you do need to check the drugs. We have a drug list on our website through aetnaseniorproducts.com, where you need to go verify that they're not taking any drugs that would be banned for this product. There's not a lot of them, but there is some. So make sure you do that, because that's the one thing that our underwriters are going to check. Once we receive an application, we are going to check the drugs. Other than that, we're not really going to even take a look at the app as long as there's no claims within the first 2 years. So if there's no claims in the first 2 years, it never goes through underwriting. Pre-existing conditions will be covered once the policy's been forced for 6 months. Everything else is covered immediately. Here's just a peek, and we won't go through this because we don't really have that much time, but this is just an example of what the app would look like. It's just a yes/no app. As far as the health questions go, it's just one page. So I couldn't fit one page onto one slide. So this would be the top portion of that page. And then here would be the bottom portion of it. So that's all you're looking at. And you can download these, or you can go online and use our e-app and look at these to get better details on it. But I just wanted to have you see that it's just yes or no questions only. Here's a couple of examples I worked up. So if you're looking at a 65-year-old and you gave them $200 of daily skilled nursing, and then you also gave 180 days of coverage with a 0 waiting period, plus a $450 weekly home care for 13 weeks, your monthly cost is only $67.31. That's a total of $83,700 in benefits. Typical first-year commission on that, and I don't know what anyone's commission level is. I just know what we consider kind of like a street level. So this is typically what most people are going to be around or close to. So your typical first-year commission is going to be about $444 on that. The next scenario down is 68-year-old with $200 of daily skilled nursing for 90 days with no waiting period, plus $600 of home care for 26 weeks. You're looking at $74.17 in premium. That's about $67,000 in benefits. First year commission is generally going to be around $489 on that. So hopefully that helps. Here's the overall review. I know many of you may have questions. We didn't say this at the beginning, but I just want to let you know that we're going to address as many questions as we can at the end of the presentation. So hopefully that gives you an idea of recovery care. Real quickly, home care is very similar, so I'm not going to spend a lot of time on this. You'll see that it's a very similar product. The one thing I'll tell you about our Home Care Plus, I'm sorry, I said home care, it's the enhanced version, which is Home Care Plus that we're talking about. And you can see the states that it's available in. The really cool thing about Home Care Plus is that of all of our ancillary or our complementary type products, this one will have the easiest possible underwriting. You can write this on someone who has already been diagnosed with Parkinson's, someone who's been diagnosed with memory loss, or Alzheimer's. If they had cancer but have had a cancer-free or a clean diagnosis for as little as 1 year, you could write the home care product for them. So here's how it works. Issue ages are the same, 50 to 89. It will pay a weekly benefit for in-home care by a home care practitioner or qualified staff member of a licensed home health care agency. Home care, this is where it's a little different than the recovery care because the triggers are different. It's not going to be based on ADLs. It's going to be based on, is it medically necessary, which is determined by a physician. So if the physician gives a recommendation, writes the letter, says this patient of mine needs this type of care, then that triggers the benefits. They have to be receiving a minimum of 3 practitioner visits per week, and they have to be a minimum of 1 hour per visit. It's a $1,200 weekly maximum that you can have paid out. You can choose the number of weeks you'd like to have covered, whether it be 13, 26, 39, or 52 weeks. And again, with your 180 days of not using the care, that benefit will restore for you. You can choose a waiting period of 20 days if you like. Again, my personal recommendation is no waiting period. It's worth it to get the services immediately if and when you need them, and it's not that big a difference in premium. Now, the cool thing about this, and I'll try to explain this the best that I can without confusing anyone, but is you're going to get whatever amount you chose when you bought the policy. So if you chose up to $1,200, which again is the maximum, then you do have to pay for that level of care, the minimum level of care, to have a licensed home health care professional come in the home at least 3 visits per week. Whatever money is left over beyond that, you can use to pay whoever you would like to come in and sit with mom or sit with dad and kind of help around the house. So that's kind of the purpose of this. This is cash money paid to the beneficiary or policyholder that's designed for them to help get the home care they need. You do have to be receiving a certain amount that's required, that's by a licensed home health care professional, but the additional funds that come from this policy can be used to pay for whatever other type of service you'd like to have coming into the home. So that's the beauty of this product, and having the benefits paid directly to you or to the policyholder. So it again is built on the backbone of the hospital indemnity. So you have that built in. Again, that's not typically why anyone buys it, but it's here. You can max it out at $300 daily if you choose. You do have to at least get the minimum, which again is going to be $10. You have 2 optional riders, which I think are really neat, that can be added onto this. You can do a lump sum cancer. So if they're diagnosed with cancer, they'll get a lump sum payout. The choices are $2,500, $5,000, or $10,000. That's one use per lifetime. And you could also add on a benefit rider for emergency room visits or or an ambulance ride. So an ER visit or an ambulance ride will pay you up to $200 twice per year on that. Must be medically necessary. We talked about the period of care. They've got to go 180 days without using the product or needing the care in order for the benefits to restore themselves or to reset. The policy is guaranteed renewable. Benefits are paid directly to the policyholder or beneficiary. Premiums do not increase based on age or health. Again, can't stress that enough. Simplified underwriting, yes or no app only. You need to check the drugs just like on recovery care. Pre-existing conditions are covered after 6 months. Anything else is going to be covered immediately. And here's an example of the app on this. And remember me saying this is the easiest underwriting we have on any of our complementary products. This is the entire app. Again, you could write it on someone who had a cancer diagnosis, but they've been healthy for at least 1 year. They've had Parkinson's diagnosis, they've had an Alzheimer's diagnosis, memory loss, things like that. And then there's several others that you can get away with. If you run into a potential client that wants to have something, wants to buy something, but they're going to have trouble qualifying, this is your go-to product. This is going to be the one that you're most likely to get someone through underwriting if they've got certain issues. Here's a couple of examples for a 65-year-old with $1,050 in weekly home care for 39 weeks, plus a $2,500 lump sum for cancer. You're looking at $81.34 monthly, and the total benefits are going to be $84,400. Typical first-year commission, again based on what we consider street level, will be $488.04. 68-year-old for $900 a weekly home care for 52 weeks. Monthly cost is around $95. That's an entitlement of $93,600 in benefits, and typical commission is $571 on that one. So hopefully that gives you an idea of what it means for the client, what kind of service and coverage they would have versus cost and benefit to you. So there's an overall review. I know some of you may have questions. I've already gone over what I targeted for this, so we're going to kind of wrap it up quick so that we can get to questions. So we have a brand new e-application. All of our products you can write over the phone or in person using our e-application. It's a great thing. If you haven't seen it yet, I'll just tell you the beautiful thing about it is you can do one app and add as many of our products as you want onto that one app. First, you build a rate quote based on the products and the benefits that you want, and then you choose which ones that you want to actually buy, and you go through that process, and it's really easy to get done. And you, again, really the best part about it is multiple products on one app. Want to let you know we're here to help you guys. You can email us at aetssiinformation@aetna.com. That's for our agent services team, and they're great. They really are good at monitoring that email box. Again, our website, aetnaseniorproducts.com, and if you want to call to just check to see if you're appointed or check on anything, 800-264-4000, option 3 for our sales team. Want to let you know real quickly as well that we've got some different, we're giving cash away basically. We've got right now, these are good for the first quarter of the year, which means they go through the end of March. And the next 4 slides are all going to be on this time period. So we're giving away cash bonus money as long as you submit any of the business by the end of March, and it has to go in effect by the end of May. So submitted by the end of March and effective date by the end of May. So basically for MedSup, we're giving away $100 per underwritten application. So if you write underwritten MedSup applications, you can get $100 bonus on that. I know spring break's coming up, summer vacation, so great way to put some extra money in your pocket there. We're also giving away bonus money for our complementary products. So for dental, vision, and hearing and our cancer, heart, stroke, $25 per app on top of your commission. For hospital indemnity, recovery care, recovery care and home care, which we talked about today, as well as hospital indemnity, we're giving away $50 bonus per application. Great way to put some extra money in your pocket there. And then we're doing a cross-selling bonus, which we've never done anything like this that I know of. It's pretty cool. If you write any of the qualifying products which are listed below, so our MedSup, DVH, cancer, heart, stroke, hospital indemnity, recovery care, and home care, if you write 3 different ones, you get $250. If you write 4 different ones, $450. And these don't all have to be on the same client, by the way. These can be spread out. If you write 5 different ones, $700. If you write all 6, then we'll give you a $1,000 bonus. That's a one-time bonus, but man, that's a great way to put some extra money in your pocket. And then last but not least, if you happen to be a new agent with us and you write at least 3 qualifying applications with a total of $3,000 in annualized premium between them, it can be any of these products that we've talked about, MedSup, DVH, cancer, heart, stroke, hospital indemnity, recovery care, or home care, then you can put up to $500 one-time bonus in your pocket on that as well. So great way to get some extra cash. Again, here's my contact info. I want to hurry and get to questions, so I will say thank you, and I will turn it back over to Rick and let me know what questions we have.
Actually, I've been getting to most of the questions throughout the presentation. So you've been busy presenting, I've been busy typing. I know I do
Awesome.
still have a couple to get to. One of them that I haven't got to yet is what type of services would trigger the benefits for the home care, for the Home Care Plus product. And as far as that's concerned, you're just having a doctor sign off that care is medically necessary. So a great example of that, something I've used in the past is, take for example, if you have somebody who is blind and needing help changing oxygen. That's not necessarily going to be something that would trigger two ADLs. However, you could have a doctor sign off with the Home Care Plus saying that care is medically necessary. This client is blind. They need somebody to help them change the oxygen. So that would be the type of situation that could trigger that policy. It's actually, benefits are a lot more accessible with that kind of stipulation on there. So that is one thing that I definitely love about the Home Care Plus plan. And then as far as how do we get access to the e-app, that's just a matter of getting contracted with the carriers. So that's right on your guys' homepage. There's actually some tabs right up on there to get to the e-app, correct?
Yep, that's correct.
Yep.
Once you're signed in, like Rick said, as a appointed agent, then yeah, you can right through our website. You can go to the e-application. It's right at the top of the page.
All right. So, yeah, I apologize if I missed you saying that earlier. Like I said, I was typing away for some other questions. So, with that being said, I know we do have a couple people here that said that they wanted to have us contact them to get licensed. So, yeah, we definitely will give you guys a ring and get you the information you need to be working with these products. And by all means, I know that Kevin already provided you with his information. If you guys want to be giving us a call here at Premier, we are happy to get contracting out to you. We are happy to get product material out to you. Whatever you need to write and get you going, it's not a problem at all. The number to reach either Christy Johnson or me here at Premier is going to be 800-365-8255. 8208. And that number one more time is 800-365-8208. And the extension for the long-term care division is 3012. So give us a call, extension 3012. We will be getting that contracting out to you, the product information out to you, whatever you need. And we are recording this webinar, so we can definitely get this sent out to you. So if you want to replay anything, if you jumped in too late, or if you had to jump off, we'll be sending this out to you. And without anything else that I can think of, Kevin, I just want to thank you for joining us today. I know you're a busy guy, so whether it's giving Kevin a call or me a call, definitely let us know how we can help you out.
It's my pleasure. Thank you, Rick. Thank you, Christy. Thank you, everyone. Have a great day.